Hello everyone, welcome back to DC Conversations. Today we are in conversation with Dr. Suman, who is the Medical Director of Boduppal branch of Ankura Hospitals in Hyderabad. He will share with us some insights on vector-borne diseases during the monsoon and also how to keep your child safe from the viruses. Please welcome Dr. Suman to DC Conversations.
With the monsoon around, we thought we'll catch up with you and ask a few questions so that it would help our readers. So the first thing is what are the most common vector-borne diseases that parents should be aware of during monsoon?
Depends on the monsoon. Basically, during the time between July to November, which is a quite hectic monsoon season, the most common vector diseases which children come across are dengue, followed by malaria, followed by chicken. It depends on which area you are there from. If you're in urban area, it's more of dengue and malaria. If you're in rural area, it's more of chikungunya.
Okay, and how can you recognize the early symptoms?
So basically, this depends on the age of the child. If the child is less than 5 years of age, where they cannot express their symptoms quite evidently, they'll be having high fever, undulant fever, which doesn't come down even with medication. And they will be excessive crying because they cannot complain of body pains. It's more of excessive crying, which would be there, and they would hesitate to move out of bed. They would like to, stick on to the bed. Normally, children run around, and this fever usually doesn't come down with medication, and the feeding usually goes down. These are the early signs of dengue most of the times. And as far as malaria is concerned, it is a periodic fever. Child will be active major part of the day. And at night time, usually the child will have very high fever associated with, usually the chills will be more dominant than the fever here. And suddenly the fever settles down with a group of sweating, there will be a huge sweating, and then the fever settles down and child will be fine for a certain period of time. And as far as chikungunya is concerned, it is another, again, confusing because dengue and chikungunya almost matches the same as far as fever and body pains is concerned initial. The initial phase of chikungunya and dengue, you cannot separate them both.
So how can parents protect their children from mosquito-borne diseases like dengue, chikungunya and malaria during the rainy season?
This is an important point because parents tend to believe that mosquito problem would be more prominent during nighttime and not during daytime. So usually, they are quite lax during day and, quite vigilant during night, most of the parents, right?
Yeah.
But the problem here is mosquito-borne infection, which is caused by Anopheles mosquito, is usually caused due to stagnant water, stagnant dirty water. Okay, like ponds and all, where you have a dirty water where it's not, it's not well taken care of, and that becomes a breeding ground for mosquitoes, especially female Anopheles mosquitoes, and especially people who are living near these water bodies, these ponds and dirty areas where sewage areas where water is quite stagnant. These are the people who are at risk for malaria. As far as dengue is concerned, it is more of stagnant fresh water. And thanks to the lot of construction activities which happens in urban areas, which are quite congested, the water tends to get stagnated at various areas. And this stagnated area, fresh water, becomes a breeding ground for mosquitoes. Not only that, even in households where there is not adequate ventilation, a lot of water stagnation because the water is stored and it is not covered properly. And even in plantation areas, and even in areas where, in old utensil areas or old sheds or places where, these areas where the water tends to get stagnated, like old tires and stuff are there. As far as malaria is concerned, it is basically because of dirty water. And it is during the lakes and ponds, people living in near the sewage water, which is quite stagnant. These are the places where malaria would be quite dominant. Understood? The parents need to be careful, especially at night. Malaria is a disease, caused by mosquito bite during night. As far as dengue is concerned, it happens only in monsoons, and especially when there is a lot of freshwater stagnation happens because a lot of construction and activities, and because the roads, a lot of puddles and stuff, the water tends to get stagnated for a longer period of time. And that is where the breeding ground, it becomes a breeding ground. Not only that, when there are old tires present and old cars present or things like that, which are not moved for quite significant amount of time, or even if the water is stored in uncovered, it's not completely protected and uncovered, and it's stagnant for quite some time, especially in houses. And your places where they keep plates below the plantation areas, where the water tends to get stagnated for quite an amount of time. Because these are the areas where these mosquitoes get breeded, and that is where the children get affected. And the problem here, what the point parents need to remember is, if it's malaria, the mosquito usually bites only one person at one point of time. As far as dengue is concerned, it can bite even 10 people. And dengue virus is not caused by contact. It is caused by a mosquito which bites one person who is affected with dengue virus and then bites another person and keeps on biting. It can bite nearly 10 people and on average in a night. That's the reason why this virus spreads quite rapidly compared to malaria, which is not that epidemic or endemic in our country.
Recently, because it started raining and all, have you been seeing cases, a rise in cases, and what kind of behavior have you seen right now?
See, there's an upward tick once the monsoon starts in the late June, in mid-June to this July. Once this monsoon starts, during the fresh bouts of rain coming in, usually it doesn't happen. But once the rain stops and settles down for a certain period of time, that's when the breeding starts, and that's when the dengue cases pick up. We have seen an upward tick as far as reporting of dengue cases are concerned. The admissions, there's an upward tick, but only good point here is so far the unstable dengue, because dengue is viruses are different types. There is unstable and stable type. The unstable types are a little bit low. It's more of a stable dengue which is moving around. But as we go forward into the season, we will start seeing more unstable dengues.
Yeah, and what are some of the effective ways to prevent mosquito bites, especially for young children, who may not understand that, you cannot get, you have to avoid getting mosquito bites. So how do you actually protect them?
Problem is young children are quite, they're quite active and they keep moving around all corners of the house, and, it's very difficult to stop them. And especially daytime, it becomes even more difficult to restrict their movement. So the best way to is completely cover their clothing, especially this monsoon season. Don't keep, because the area of contact would be always the exposed parts for the mosquito. So more they cover, especially they do not stuff them out with heavy woolen clothing and stuff like that. Even they can wear a cotton clothing where the entire leg area and the hand area are covered. And even if it's a small baby less than 1 year or 2 years, I would expect them to wear mittens as well. So the more covered, the less the mosquito bites. Second important is have repellents for 24 hours. You have repellent, normally use it for only during night. Would recommend, especially with children below 4 years or 5 years, where they are all corners of the house. We use repellents throughout 24 hours. Third is have good window screens as far as mosquitoes are concerned, and see that ventilation is done only during the peak sun. When the sun is out and there is adequate sunlight, then only try to open the windows. Otherwise, try to see that the screens are there. Windows are open, but mosquito screens are present. So sunlight and wind is coming in, but house is well protected. Even the main doors, there should be a screen present. And it's better, children who are sleeping at night, there is a mosquito bed net available. Don't depend entirely on the repellents. The bed net is also available. And these are certain strategies. Obviously, the important strategy is to avoid water stagnation in and around the area and see that the water areas are well covered. So this is the best method to prevent children from, avoid children sitting in dark corners of the house. That's the area where, that's the areas where mosquitoes, coolly settle down and the children tend to get bitten. It's better we avoid dark corners, see that the house is well ventilated and children don't sit in certain corners like, below the steps or some corner of the house where there's not adequate ventilation.
What are some of the myths and misconceptions about vector-borne diseases that parents should be aware of?
I think that's a good question, actually. There are a lot of myths surrounding this infection. So I'll start off with one basic thing. Since dengue infection especially starts off with a very high fever, which doesn't settle down even with syrup. So the parent's conception is to kill the fever. We should never be killing the fever. So when virus is active in our body tends to react to it and you get fever in response. So you should not be killing the fever. You're killing the fever means your response to the virus automatically comes down and you'll be having more problems as far as the virus replication in our body is concerned. Second aspect is if you're killing the fever, you're giving too much of anti-inflammatory medications, the fever medications, instead of focusing on hydration. That itself causes a lot of side effects like gastritis, and it also causes a lot of platelet destruction, more platelet destruction than what normally happens with them. So simple paracetamol is good enough in managing dengue. Sponging the child and hydrating the child becomes really important, and feeding the child, see that the child is well fed is really, really important rather than child becoming dehydrated, because that becomes another bigger problem later on. Third aspect is it is not the fever actually which causes harm in dengue. That's an important thing which parents need to remember. You need to sponge and keep him hydrated. It's the discomfort of fever will not cause any problem to the child, but it is after the fever which actually causes the problem. So compared to other viral fevers, normally other viral fevers usually settles down by day 3 to day 5. Once the fever subsides, everything usually settle down. But here, once the fever subsides, the critical phase starts between day 3 to day 5 in most of the dengue patients. So that's when the patient actually becomes sick. Once the fever settles down, the platelets also tend to drop, because what happens once the fever settles down indicates the virus is out of the body, but your antibodies for the virus are still actively moving around the body. Unfortunately, your platelet receptors matches that of the virus, and your own antibodies tend to think that these platelets are nothing but viruses, and they start eating on the platelets present in our body. That's where the platelet destruction happens, because more amount of virus load, more the platelets tends to get destroyed. So that's the reason why we should not overkill the fever. And day 3 to day 5 in dengue is very, very important. So don't worry about the fever. Hydration becomes really, really important for the child. And 90% of the dengues, the second myth surrounding is the platelets. So 90% of the dengues are stable dengues, means this child doesn't require any treatment other than paracetamol and good fluid intake and under observation of the doctor. No need to over-treat it and overdo it. And don't worry about this normal thing of 1,50,000 and above platelets. Anything below is going to cause any problem. Actually, human body requires only 20,000 platelets, 15,000 to 20,000 to be frank, to keep our body stable and running. You have, almost 15,000 to 20,000 platelets developing every day in our body on a natural process. So it keeps happening on a daily process. So don't overthink about platelets and don't think that, something needs to be done as far as platelets is concerned. It's the child is stable, child is in a position to eat, child is passing urine well, child is moderately active. Platelet of even less than 50,000 is okay for the child. We don't need to worry. If the child is not in a position to move, not passing urine regularly, there is swelling present in the body, or there is any bleeding manifestations happening in the body, the child is not in a position to eat at all, severe myalgia or body pains are there, not in a position to move, that is the child who requires observation and needs to be admitted in the hospital, means he is having some warning signs or he is unstable. Otherwise, rest of the children, you don't need to over-treat as far as platelet is concerned. Third myth surrounding is giving too much of papayas, kiwis, this papaya leaf extracts and all that stuff.
Yeah,
because this is a market-driven stuff. Actually, it doesn't help. It is proven beyond doubt, because platelets naturally pick up after day 5 to day 6. The platelets will automatically pick up. What happens? The antibody load comes down, and the amount of platelet destruction also comes down, and the body comes back to the normal response, because all this, whatever happened in day 3 to day 5, they tend to reverse by day 6 to day 7, and by day 7 the child is absolutely fine. So the people tend to give a false impression that you give a platelet extract for 5 to 6 days, after 6 days the platelets tend to improve. Naturally also the platelets will improve, but giving too much of papaya leaf extracts and kiwi might itself cause a significant problem to the child. So keep the child well hydrated, let the child eat healthy stuff. He's eating papaya, no problem, but don't see that he eats papaya all along throughout the day, and let him eat everything and let him see that he's well hydrated. That becomes more important than these platelet extracts and stuff. And last important aspect is the rashes tends to appear once the child becomes stable. So don't worry about the rashes. The child's itching starts once the child is coming back to normal. So if child is having itching followed by rashes, it's a good sign as far as dengue is concerned. So please don't worry about it.
Okay, one last question. Is there a preventive shot? I mean, could kids take a preventive shot or a vaccine kind of thing to avoid any of these vector-borne diseases?
See, most of these vector-borne diseases, other than Japanese encephalitis, there is no vaccine at present. There is a research going on as far as dengue virus is concerned, that is to prevent children, because what happens is primary dengue means people who are affected for the dengue for the first time, usually 99% of the children are stable. It is only children who are affected for the second time dengue, which is more risky, because the antibody response would be very higher and the child becomes sick by day 3 itself. So more systems would be involved in these children. To prevent this secondary dengue, there is a vaccine which is being developed. It is only for those people who have been affected for dengue for the primary. These are the people who have to be vaccinated so that they are prevented from the secondary dengue. But it's still in research stage. Still a lot of time to go before the vaccine actually hits the market and helps the people from it, because this is unstable dengue is what is life-threatening. So the vaccine is already in the process, but yet it has to enter the market. It's still in clinical trial stage. That's what I want. So the best method is to see that you maintain a proper hygiene, see that your surroundings there is no water stagnation, see that your water in your house is well protected and well covered. You keep it clean and dry as far as possible, avoid dark corners in the house, and see that we have well protected clothing.
Thank you, doctor. Thank you so much for talking to us.